Excellent. Thank you so much. All right, everybody, welcome back to Public Benefits Are Key. As a reminder, if you'd like to introduce yourself in the chat, we have a number of, community providers and advocates and wonderful folks here. So feel free to introduce yourself using your names, your pronouns, and your contact information in the chat if you'd like. Also, feel free to rename yourself in your description. This session, we're going to be talking about healthcare. We're going to be talking about Medicaid, Medicare, and Spenddown. And we're going to be hearing some really well-informed and actionable information from Hannah Rosenberg at Seattle at Solid Ground. So we'll hear from Hannah in a little bit. If anybody is unfamiliar with the coalition, we are a true coalition of 40 plus organizations in King County that advocate and serve folks experiencing homelessness. We do a number of different policy advocacy efforts at the local, county, and state, and sometimes federal level. And in addition to that, we do our best to provide providers.
Tim, you muted yourself.
I am muted. All right. Sorry about that. I lost my train of thought for a second. So we do a lot of provider supports in addition to policy advocacy and budget advocacy and all that good stuff. One of those ways is to provide provider trainings. We're focusing on public benefits today. We've also provided public benefits trainings on things like TANF and cash assistance. We have a food assistance benefits training coming up. We've talked about more time-sensitive things like the Working Families Tax Credit, and we're going to be talking about like long-term care access in a couple months. So this is a great place to be if you're looking for information to pass on to your clients or your community members. We're talking about public benefits today because we know that they're an important method of ensuring that folks experiencing homelessness and housing insecurities receive essential resources that they do not receive elsewhere. These systems are in no way perfect, but they do help to, there is, data showing that these public benefits program help a person to achieve their personal goals. So you know what to expect. This training is going to be until 11 a.m. We're going to take breaks from our presentation with Hannah so that folks can ask questions. During those Q&A portions, you're welcome to share your thoughts in the chat, and I will log them throughout the presentation. Or raise your hand and unmute yourself so that you can share verbally. We can get to you either way. Again, we're recording this. That recording is going to be posted on YouTube and is going to be linked in a follow-up blog that's going to be shared with everybody a few days, probably early next week, with everyone who is registered so that people can continue to access this information. And because we are, sharing this information, we care about this information and your experience in these trainings, we want to hear your feedback. I am going to share a link in the chat now and a couple other times in the training just to remind you, if anybody has any feedback about this training, we'd love to hear that. And if you want a follow-up conversation, you can also flag that in the training survey and we can get back to you pretty shortly. We're really close to getting started. I do want to just quickly mention a couple coalition events that are coming up that you may find of interest. We have our July general membership meeting coming up featuring a presentation from Kate Baber, who is on the Crisis Care Center Implementation Board. That is next week, I believe. Thursday, July 20th at 9 a.m. The registration link is going to be placed in the chat now. And then we also have a specialty training that's coming up that we hold once a year on August 1st for providers of K through 12 students experiencing homelessness. There are a lot of, there's a lot of like legal infrastructure to support students experiencing homelessness. Children and families experiencing homelessness are in uniquely vulnerable positions sometimes. So we want to be able to let you know, along with our partners at the Building Changes, let you know what resources are available, what school districts are mandated to provide, and just helpful resources so that your families and students can be supported. I'm going to post that in the chat as well. And then I think once we've shared that, I would like to pass it over to Hannah to share a little bit about health insurance.
Great. Thanks so much, Tim. Hi, everyone. I see some familiar faces that have attended and participated in our previous training. So great to see everyone. I am going to share my screen. All right. I'm going to put this in presentation mode and close the box here. It always distracts me when I can see the faces, although I love to see everyone's faces. So hi, everyone. I'm Hannah Rosenberger. I'm the program manager and an attorney with the Benefits Legal Assistance Program. We are part of Solid Ground, located in Seattle, Washington. We at Benefits Legal, we provide free legal services to low-income individuals and families in King County who are dealing with some issue with their public benefits. So that could be they've been terminated, their benefits have been reduced. We're going to talk about Medicaid today. So maybe their insurance company has denied some kind of durable medical equipment. Maybe they were assessed an overpayment. Those are the type of things that we can help with. We do work on Medicaid cases, but also things like food assistance, cash assistance like TANF, state disability benefits, and long-term care cases. So today we'll be talking about Medicare and a little bit of Medicaid and a little bit of Medicare. But if you have a client that is dealing with maybe a TANF or a food assistance issue, that's something you can reach out to us as well. All right, so before we begin and kind of get into the meat of our presentation, I always want to take a moment to name and acknowledge the fact that what we're going to be talking about today, the public benefits system, healthcare access, it's really, these laws and policies are steeped in systemic racism. And there's a lot of history of stereotypes being used when people are receiving public benefits or having trouble accessing healthcare. So it's not something that we'll have time to get into today. We have 2 hours and a lot of information to share, but I didn't want to just breeze by this very real fact. And these systems can be systems of oppression in their own right. So I've included some links to further reading if anyone is interested in diving into that further. And one more slide before we get into, again, the meat of our presentation. Because you all are attending today and participating in this training, you have access to this additional technical assistance program. We're calling it our Ask a Lawyer program. So if you have a specific question that has come up with a client, or maybe you're seeing something happen with many of your clients in a trend and you're not sure if it's something that you can do anything about, or if there's some help out there, we have this email address. It's benefitslegalhelp@solid-ground.org. And if you put Ask a Lawyer in the subject line, one of our public benefits attorneys will respond. And the idea with this program is we want to be able to provide technical assistance or advice before something goes wrong or before there's a legal issue that might necessitate your client having to get a lawyer or reach out to us. Sometimes these Ask a Lawyer questions turn into referrals, but other times we're just able to answer questions for the case manager or the client, and then they're able to more effectively get their benefits or apply. So just wanted to plug that. I will include all of this information again at the end of the presentation. This is an overview of what we're going to talk about today. our program, Benefits Legal at Solid Ground, we don't do Medicare work. We mostly work on the state side, which is Medicaid. But I do have a brief overview of Medicaid to set the context for a state program that can help with Medicaid payments. But we'll mostly be talking about Medicaid today. And then the idea of this training is not just to tell you about Medicaid and Medicare, but to provide kind of tips and advice for case managers as you're helping your clients navigate these systems. And then just some helpful definitions. I sometimes just use these initials without remembering to tell, to actually say what they stand for. So the Healthcare Authority, or HCA, this is the state agency. You may all be familiar. It administers most of the Apple Health programs in Washington State. We also have DSHS, Department of Social and Health Services. That is another state agency that administers some of the Apple Health programs, and we'll talk about the differences. Earned income, I'll be throwing that term around a lot. That means money from wages or employment. And then we also have unearned income, which is money from any other source other than employment. So that could be unemployment benefits, Social Security, child support. Resources, which we'll also talk a little bit about today, that means things like cash, savings accounts, checking accounts, stocks, bonds, mutual funds, real property like a home, or vehicles like a car or an RV. So that's what I mean when I say resources. And then PHE, you all may be very familiar with this term, that stands for the public health emergency. And when I mention public health emergency or PHE, I'll be referring to the COVID-19 public health emergency. Oh, and I should say, I've broken this presentation up into sections, so I will be pausing for questions at the end of each section. And then I'm not able to monitor the chat while I'm sharing my screen, but Tim is going to be monitoring the chat. So feel free to, put anything in the chat, or if you want to come off mute during the question session, I'd be happy to hear directly from folks. All right, so after all of that, we can get into the actual meat of the presentation. So what I wanted to start talking about is the post-COVID, the unwinding of the public health emergency. And I will say, I do hear some feedback. I'm not sure if folks can just make sure that they're muted. That would just be helpful, or else I'll get a little bit distracted. So thank you so much for that. So during the COVID-19 pandemic, the public health emergency, there was a rule in place that the state could not terminate people from Medicaid, even if something happened that would make them not eligible. Maybe it was a child that was on CHIP, the child healthcare, and then maybe they aged out of the program. Or maybe someone was on Medicaid, but then they started getting Social Security, so they should go to Medicare. Whatever the reason was, the state could not terminate people, which was really helpful. It just gave people stability during a time of great upheaval. But now Washington Apple Health Medicaid renewals are starting again. And in fact, they've now been starting for a couple months. The important thing here to ensure that folks aren't losing their health insurance is, like, the biggest thing that folks can do is to make sure that clients' contact information is updated with DSHS and or the Healthcare Authority or the managed care organization that a client is getting their care through. So if a client is their managed care organization is Molina or Community Health Plan of Washington, or maybe they are mostly dealing with DSHS, whoever their health insurance contact is, that's where they're going to want to make sure that their phone number, mailing address, and any other contact information is up to date. And the reason why that is so the state has been sending out letters and notices to folks saying, okay, it's time to get your renewal, fill out this form or go to this website and do your renewal. But if somebody hasn't, they've moved or they haven't updated their address, they may not get the letter, and then they could end up getting terminated from benefits. I have some specific slides about how to actually renew and what happens if you've maybe already lost your insurance. But if you're not sure, or your client isn't sure if their contact information is updated, they can review the information and just actually submit a review on Washington Health Plan Finder or Washington Connection client account, wherever they are getting their care from. And then another thing that's changed is premiums were also suspended during the public health emergency. So there are some folks that are low income, but on the higher end that would have to pay premiums for Apple Health Care for Kids, and individuals that are receiving Apple Health Care for workers with disabilities. There are premiums for those programs, but they were suspended. The premiums for the workers with disability, that starts August 15th. And then the Apple Healthcare premiums for kids, that started actually July 15th. So that's next week. So that might just be something, especially if someone got on these benefits during the public health emergency, they may not even realize or remember that there are premiums. So those are starting soon. So how to actually complete a renewal? If somebody is receiving, so Apple Health clients who are aged 19 to 64, maybe, or they're a child, or a parent or a caretaker of a child, or someone who is pregnant, those folks are going to be doing their renewals on WashingtonHealthPlanFinder.org or through the Washington Health Plan Finder customer service phone number. You can do it online or over the phone or in person. We're going to talk a little bit about, Apple Health. It's kind of the umbrella term for Medicaid in Washington state, and there's different people fall into different categories. And if your client isn't sure, is it Washington Health Plan Finder, is it Washington Connection, they can always call one of those agencies and they'll be directed to where they should go, or look at the most recent notice or letter that they got about their health insurance, and that will tell them where they, are they a health plan finder client, or are they a Washington Connection client? So clients that are on Washington Health Classic Medicaid, so these are folks who are over 65 or older, they are blind, they have a disability, maybe they're getting long-term care services. Those folks are going to be doing their renewals on WashingtonConnection.org, or by calling DSHS at that customer care number, or by going in person. So this is how you complete the renewal. And I want to add a tip here. The important thing is to fill out the renewal as soon as the client gets it, even if they don't have all the information. So it's better to send in the renewal with as much information as they have, rather than wait to try to get all the information. Because if the client submits a renewal, then if there's information missing, DSHS or Healthcare Authority will send a follow-up letter and saying, okay, we got your renewal, but we need, X, Y, and Z. So their renewal will have been noted, it will have been counted, and they won't be terminated. And they'll have a certain amount of time to get the additional information. If they just wait to get all the information and kind of send it as a nice package tied up with ribbon, if they've missed a deadline, they could be terminated. So that's just a tip. It's better to get the renewal in as complete as possible. And then if they need to supplement, they can do that. So this is what's happened is if you've missed a deadline, or let's say your clients missed a deadline and they've already lost Apple healthcare coverage. So the individual or the household who's lost coverage, they have 90 days to complete the renewal using one of the renewal options we've talked about. So the first thing to do if a client has come to you and says, I got this termination notice, or I went to the doctor and they say that I'm not covered anymore. Like the first thing to do is do that renewal, even if it's already past the deadline. And the reason why is because if the client is eligible to get back on Apple Health coverage, their coverage will continue from the date that they lost coverage without that gap. So that's why it's important to do that as soon as possible. And then also, if the client really doesn't qualify for Apple Health anymore, but they do the renewal, they may qualify for another coverage through a qualified health plan, which is kind of when you think about the exchange, that's where that happens. But they may qualify for help paying for premiums, but they won't know unless they've done the renewal. So that's the last bullet point there is, complete the renewal to see if you qualify for one of the plans or maybe one of these alternative coverages. I just wanted to see if I have any notes there. So that's kind of my spiel about the renewal and the unwinding of the public health emergency. Before I go into what is Medicaid and how do you apply and what does it look like, I would love to pause here and just hear or if you don't want to come off mute, put your thoughts in the chat. Like, what's happening? What are you seeing with clients? Are your clients losing Medicaid coverage? Are they having trouble updating their contact information? We've been doing some advocacy with another organization, the public Northwest Health Law Advocates, and there's some meetings coming up where there's this opportunity for us to elevate what's, client voices and what's happening. And we haven't in our office, so we represent clients on these cases. We haven't been seeing it yet with our clients, but it's just started in the last couple of months. So I want to stop talking and pause there and just hear from folks on the call. What are you seeing? What concerns do you have? Any trends?
Good morning, Hannah. This is Barb Hart.
Barb,
hi there. So what about someone who's receiving SSI payments, and they may have understanding, from what I understood from this particular client, they did not understand that they were to recertify or re-enroll for the Medicaid, and they now owe a bill because they lost that coverage and probably did not recertify in time to have.
Yeah. Oh, sorry, go ahead. I cut you off.
And I'm sure they probably could requalify, but would that old bill be covered at that time or no?
Yeah, so if they qualify and they just have to renew, but they've incurred some expenses, if their coverage will, this restart date will be from the date that they lost the coverage. So what should happen is they should, let's say they renew, they do their certification, they should tell the doctor's office, please resubmit this bill to Medicaid and rebill it. And then the doctor's office should rebill, and then it should be covered because now the client was covered during that time period. So that's why it's really important for folks to do the renewal as soon as possible, so that in the situation Barb talked about, they can ask the medical provider to rebill Medicaid, and then they wouldn't be responsible for that bill. So that's my advice for that situation.
Thank you. I will guide the person to do that, to see if they can get that coverage, because the bill is over $1,000. So.
Right. Yeah, that's more than SSI, the monthly payment anyways. Yeah.
Right.
Yeah.
Thank you.
Mm-hmm. And I should say that some folks will be automatically re-enrolled. What the healthcare authority is doing is, if somebody can be automatically enrolled, like let's say someone is getting Social Security benefits, and so the state they have some access to like other state agencies or how much someone's getting in federal benefits. So if they can be automatically re-enrolled, they will. But our concern is just, if folks haven't been doing any recertifications because they haven't needed to, so maybe their information isn't up to date in one of these other systems. That's kind of the folks that we're concerned about.
Awesome. We have one question in the chat from Sophia. Sophia asks or states, most of my clients aren't able to update contact info themselves online. Realistically, it's hard for me to make an account for 40 clients and update their info. So is there any easier way to go about it?
That's a really good question. I'm trying to think if I have, the tough thing is, I don't know, other than, I don't have a good workaround. But I think what you mentioned, Sophia, that's something very important that we need to elevate to DSHS, Washington Health Plan Finder, and try to push the department to address that, or to be able to make it easier. Like, this is one of the trends that I really appreciate you elevating, because my thought is, for some of our clients, we are authorized representatives, which means we get copies of their notices. We're able to do reviews on their behalf. We usually do it for clients that, and I'll talk about this later, that have trouble getting their mail, and so they're constantly being terminated from benefits. So we're able to get copies of the mail. But, and individuals can be an authorized representative, but also an agency can be an authorized representative. So sometimes it's benefits legal at Solid Ground is the AREP. And then you're able to call in on someone's behalf and update information. And I'm not sure if you're an AREP, maybe someone on the call knows this. If you are an authorized representative, if you have your own Washington Health Plan account as an AREP, and then maybe you're able to update folks individually that way. I'm not sure if that's possible. I don't know if anyone on the call has experience doing that. That could, or maybe someone else on the call has some ideas and can chime in.
Yeah, I will say, from what I've heard from the healthcare authority so far is that the web portals are the best way. I believe I have seen a phone number that they recommend calling if a person does not have consistent web access. So let me, Sophia, if you could put your email in the chat, I can email that to you directly. I can look it up after the training, and I'll include that information in the follow-up messaging as well. Yeah, hopefully that will help. And if anyone else has any ideas, you're welcome to chime in too. I know this is a confusing time navigating the unwinding, but if anybody knows anything, we'd love to hear it.
Yeah, I don't pretend to be an expert on all things renewal or Medicaid or Medicare. I'm always happy to just be quiet and hear from the folks that have the important information to share. Okay, I'll keep us moving, but we'll have more time for questions. And if people think of things as we go, if you want to put them in the chat, that would be great. All right, back to our, what do they say? Regularly scheduled programming. Okay, Medicaid in Washington State. I mentioned that the term Apple Health, that's kind of our umbrella term for Medicaid in Washington State. And what Medicaid is, it is the state-funded healthcare program. So it pays for healthcare for low-income individuals and families and children in Washington State. There are a couple different types of Medicaid. We're going to just talk about two today. The first one is we call MAGI Medicaid. You may have heard that term. It stands for Modified Adjusted Gross Income. So my tip of how I remember is MAGI, the I, it stands for income. So that's how you know this one is the base. This type of Medicaid is based on your income, and it's your adjusted gross income based on when you file your taxes. And there are deductions that we'll talk about. So if somebody might think that they're over the income limit, they may not be. The other healthcare program is called Classic Medicaid. Sometimes we call it non-MAGI. You might hear that term, or age blind and disabled Medicaid, or long-term care Medicaid. And so this program is for people who are aged, blind, or disabled, or need long-term care support services. So maybe somebody who needs an in-home caregiver or is in a nursing facility. So the first part here, we're going to talk about MAGI, this Modified Adjusted Gross Income, kind of just the basics. This is Washington's main Medicaid program, and this provides health insurance coverage for low-income Washington residents. So in the past, if you heard of the term Medicaid expansion, or we have the Affordable Care Act, before that happened, in order to get Medicaid coverage, you had to meet certain requirements, like you had to have a disability, be a child, maybe have children in the home. After the Affordable Care Act, adults who don't meet those requirements could now get Medicaid coverage if they meet certain income limits. So who all can get coverage under Apple Health MAGI? So this is generally for people who are 19 through 64. If you're over or under that age, you're probably going to be eligible for one of the other programs. there are citizenship, immigration status requirements. You do have to be a resident in Washington state. You cannot already be on Medicare. You can be a parent of or a caretaker of a child or a dependent adult that is on Medicaid. If you are part of the Family Planning Services Program, there's a carve out for those folks. And then the household income is at or below 138% of the federal poverty level. And I do have a slide on the next slide that actually gives some numbers. Just a note, children and pregnant persons may qualify at a higher income limit level than that 138%. And if you're not sure if your client is income eligible or if you have a question about immigration status, I've included a link here that will, it gives a good overview of eligibility. So I mentioned there are income limits for the Apple Health Magi program, and you can get an idea that it's it kind of ranges from 103% to 260%. I mentioned that there were premiums for some Apple Health for children that's starting again. And so you can see those are for folks that are, up to 312% of the federal poverty limit might have premiums. And then I only gave the numbers for up to 3-person household, but all this information is on Washington Health Plan Finder. So if you can check that link on the page before. So income, I mentioned just very briefly, someone may look like they have, you're not sure if are they over income or are they not income? Well, what income is actually counted? So this is just an overview. This list is not an exhaustive list. There are other types of income, but this is kind of just some general. It's things like wages, unemployment benefits, if you're on Social Security, if you have rental property, if you're self-employed. These are the sorts of things that are going to be counted as income. So when you apply for benefits, you're going to have to maybe provide proof of your wages or a pay stub showing what your rental income was, or pay stub. You maybe wouldn't have a pay stub for rental income, but maybe for your Social Security benefits. So there are some types of income that are not counted. Those are things like if someone is getting benefits from the VA or child support or certain tribal income, a gift or inheritance, those things are not going to be counted as income. So again, if you're not sure if you're income eligible, I've included that link again there. And you can kind of type in information about your client or yourself, and then it'll let you know if you may be eligible or not. So there are deductions, and this is, I mentioned someone might seem like they're over the income limit, but actually there are these deductions that might be able to get them under that income limit. And those are things like if someone is paying spousal support, if they have student loan interest, if they are self-employed and paying their own health insurance contribution, maybe they have they're paying taxes because they're self-employed. Again, this isn't the entire list, but it just gives you an idea that there are deductions out there and it might get someone underneath the income limit. So what resources count or do not count? Well, the good news is this Apple Health Magi program does not have a resource or an asset limit. It is based on income, not resources. The other types of Medicaid we're going to talk about do have resource limits, but for this type of income-based Apple Health, there are no resource limits. So how do you actually apply? There are a couple of different ways. There's an online application at Washington Health Plan Finder. There is a mobile app. You can apply over the phone. You can mail or fax in an application. And then there are also health plan navigators. There's a website there. So if you need help, even just figuring out, do I qualify? Should I apply for this program? There are navigators that are available to help. I just wanted to see if I have any notes. If you apply through Washington Health Plan Finder, and if you are not eligible for the free or low cost Apple Health, you may still be eligible for a qualified health plan, which is through the exchange. And you can still go through Washington Health Plan Finder to see if you might be eligible for help paying for the premiums. for the qualified health plan. So again, if the income's a little higher and you're not sure if you're going to be eligible, it's still worth it to check out Washington Health Plan Finder and see what you might be eligible for. So what will you need when you apply? As I mentioned, you are going to need proof of your monthly income. So maybe you have a tax return, pay stubs. If you are not a US citizen, you will need to provide information about what your immigration status is, date of birth, of course, for each family member. They need to know what the age of each family member is to determine what type of coverage Medicaid they're going to be available for, and then Social Security number for each household member who's applying for coverage. Just to note that domestic violence survivors may not need to provide a Social Security number if that would be unsafe. So just something to keep in mind. And then a question that we get sometimes is, when can I apply or can I switch plans? A lot of times people hear about open enrollment, but the good news is for this type of Medicaid, you can apply any time of the year and you can actually switch the plan that you're on. So maybe you're on Community Health Plan of Washington and you want to switch to Molina. You can switch plans as often as you want, but you can't do it within a 30-day time period. So I suppose you can't switch every week, you can't switch as much as you want, but you can switch every month. And then you can call the healthcare authority at this 1-800 number to do that, or go on Washington Health Plan Finder. So what changes? That's a question that we also that we get from clients often. Things change. Do I need to report this? Do I not need to report it? So this is a list, kind of a long list of things that you're supposed to report if you or someone in your household has a change in income. So if your income goes up, if you move, if you get married or divorced, if you become pregnant or maybe give birth to the child, there's kind of this, I won't go through the entire list. And the reason why you're required to report these changes is it could change the coverage that you qualify for, or if you were paying premiums and something's changed, your income has gone down, maybe you won't have to pay for premiums. And if you have a change, you can report it by going to Washington Health Plan Finder. You can report it online. I always tell clients, keep a record of anything that you've reported, just so that if down the road, Washington Health Plan Finder says, oh, we didn't know that your income went down or went up, you have your own proof that you did report. So I mentioned a few times this term managed care organization. And so what this is although Apple Health Medicaid, that's the name of the health insurance coverage, there are actually these managed care organizations that actually facilitate the coverage. So they're the ones that, they get the bills and they pay the bills. And if you have a question about, is this prescription covered or is it not covered? This is who you'd be talking to, the managed care organization. There are 5 in Washington state. Not every program is available in every county. I don't actually know off the top of my head who's available where, but just, a note that depending on where you are, you may only have 2 choices or 3 choices. And some tips for advocates when working with or helping clients with managed care organizations. As I mentioned, most Washington Medicaid members will be enrolled in a managed care plan. So they have this managed care organization. And this is who sets the doctor network that you can choose from. And I guess I already said plans aren't available in every area. And so all of the managed care organizations are going to have the same basic benefits. They're required. There's a minimum requirement of what they're supposed to provide, but each plan may have extras. And so this is why someone might want to choose one over another. It could be because certain doctors are in certain networks, or maybe, an example is you get a free cell phone, or sometimes there's like Boys and Girls Clubs membership, or they will provide transportation to ride. There are these extras. And so just some tips about how to help clients choose. I will say when clients ask us, which one should I choose? We aren't able to assist clients with that choice, since we aren't healthcare experts or providers. But what I do recommend to clients and advocates is, determine the specific needs that your client has and each individual member of the family. You know, are there children? Are there not children? Are there elderly individuals? And then you can go through each managed care plan and see what the extras are and what most fits for what they need. You know, I have an example here: disability advocacy, family coaching. That might help them determine which MCO is the best fit for them. All right, that concludes our Magi Medicaid section. So I'll pause there to see if there are any questions before going into the classic Medicaid programs.
There are no questions yet in the chat. I do want to respond to Sophia, though. I looked into some resources available for what the HCA is calling ambassadors. So advocates for folks who may be losing their insurance. And they recommend calling one of two numbers. They were listed in two different places. I can't endorse these contact numbers. I'm not sure the quality, unfortunately. But I would say probably to try the Healthcare Authority Customer Service Center first. And then, because it seems like the Health Plan Finder Customer Support Center mostly would work for people with Magi Medicaid as opposed to classic Medicaid. That's my recommendation. Based on limited information, I will include this in the blog and the follow-up communication.
Thanks, Tim. Yeah, I think it's still very new, the unwinding, and yeah, I think we're kind of uncovering what all the bumps and obstacles. I think we as advocates probably could have anticipated and did anticipate what these bumps would be. So thanks so much for filling that in. I'll just keep plugging away just to make sure we get through everything. Okay. So we talked about the Magi, the income-based Medicaid. Now we're going to talk about, again, we kind of sometimes call it classic Medicaid or age blind and disabled Medicaid. This is for folks that are over 65 or older, well, 65 or older. They maybe have a disability, are blind, have a Medicaid with a Spenddown, which we will talk in detail. If you're receiving SSI, this is the kind of Medicaid you would get. And there is a Medicaid buy-in option for people who are working with disabilities under the age of 65. The acronym, it's MBI/WPD, if you've ever seen that or heard that, that's what that stands for. And people who receive cash under SSI, I mentioned, they're actually automatically eligible and enrolled in Medicaid. That's what happens when you get approved for SSI. But if somebody's not receiving SSI, but they may fit, under one of these categories, then they may have to apply. So the first subset, there's so many different parts of Medicaid, but a very common one is called the Categorically Needy Program. And this is for folks who, I guess I said this on the last slide, this is for folks who are on SSI. So they're going to be automatically enrolled in Categorically Needy. It has the same income and resource limits as SSI. So I mentioned that the other Medicaid program, Magi, we talked about, doesn't have a resource limit. Well, these classic programs, they do. And it's $2,000 maximum, not $2,001, it's $2,000. And that's because that's the resource requirement for SSI. Yes, so there's also a program called Categorically Needy SSI Related Program. So this provides that categorically needy coverage to individuals who meet the SSI income and resource requirements, as well as something here. So this might be someone who's not on SSI for one reason or another, but they're considered SSI related because they meet the income resource requirements and they are over 65, they're blind, disabled. So if you're working with clients who are on ABD, age blind or disabled cash assistance, they're probably on a categorically needy type Medicaid. This is the income and the resource limits for this year. So that $914, it may sound familiar because that is the SSI amount. And then it goes up to $1,371 for a couple. And then the resource limit is $2,000 for individuals and then $3,000 for a couple. Oh, I should say, I don't know if we're hearing that feedback. I don't know if the feedback is coming from me or maybe someone on the call, but I'll keep talking until it bothers everyone else. I wanted to mention here, so the medical certification for categorically needy, it's for 12 months. So people will do their annual renewal, and then they're certified for 12 months. And then they're going to be able to just, there aren't, if you're familiar with food benefits, sometimes, you know, there was 6-month mid-certification reviews. For medical programs, it's every 12 months. So how would you apply for categorically needy? Usually what happens is somebody gets approved for SSI or age, blind, and disabled benefits, and then they're automatically enrolled in categorically needy. So somebody to apply for SSI, you apply through the Social Security Administration, and then you apply for ABD through DSHS. You know, if you come across a client that is on ABD or should be, or you think fits all of these and isn't getting any kind of coverage, they can affirmatively apply. They can go through WashingtonConnection.org, they can call or go in person. The application is online, they could print it out and mail it in. So hopefully folks are getting automatically enrolled in this program, but if not, they can affirmatively apply. I think if it's okay, I might skip this question slide unless there's anything, and then I can just keep on going so that we don't run out of time. But Tim, I'll just pause. Are there any questions so far?
No questions in the chat currently. Again, if anybody wants to share verbally, you're welcome to unmute and ask a question.
Yeah.
I have a quick question.
Yes.
For the limit shared about SSI, is that the same limit for SSDI as well? No.
So SSDI, there isn't a resource limit for SSDI because that is, it's based on somebody's work history, how much they paid in taxes. It's not considered like an entitlement program like SSI or like a public assistance program like SSI. If somebody's on SSDI and their income is over $914, they're not going to be eligible for categorically needy. They might be eligible for another type of Medicaid program, which we're going to talk about, called medically needy, or they may be on Medicare if they're on Social Security disability. So Medicare is going to be their primary. And there are some folks that are on Medicare and are also going to be eligible for some Medicaid coverage, which we're going to talk about near the end of the presentation. So it's possible that folks are getting kind of a combination of Medicare and Medicaid, but categorically needy, that's pretty strict $914 income limit. Hopefully that answered the question.
Yes, thank you.
Okay.
Thank you so much, Brianna. One more quick question in the chat, kind of going along with that, Fred. If a person is on SSGI and makes more than $914, could they apply for Magi Medicaid?
No. So, well, I should say, Magi, you are not eligible for Magi if you're receiving Medicare. And so what happens when someone gets on SSDI, Social Security Disability, is there's this 24-month waiting period, and then they get on Medicare. But oftentimes what happens, and I'm sorry if I'm kind of going down a rabbit hole, but oftentimes when someone gets approved for SSDI, the date of their disability is like 3 years ago. And that's why people will get like back pay when they get on benefits. So that also is the clock for the 24 months. So someone might get on SSDI and immediately get on Medicare because they've kind of had their 24-month waiting period while they were going through the process. Some folks get on SSDI and they haven't finished their 24-month waiting period, so they're not on Medicare yet. So that might be someone who could get on Medicaid while, until Medicare kicks in. And then at that point, they would be on Medicare. Yeah, so you can't get, if you're on Magi or if you're on Medicare, you're not going to be eligible for Magi Medicaid. So if someone's on Magi, it probably means they're not on Medicare. It's just clear as mud, right, everyone on the call? But I will plug the Ask a Lawyer program again. So if you have these questions that come up, or you're meeting with a client, you're you're not sure and you're trying to call, DSHS or healthcare authority, you just can't get through, please shoot us an email. And if we can answer it, we will.
I have one other question,
Yeah.
kind of in this rabbit trail of tangled benefit combinations. You were saying you're going to talk about the Medicare spend down that's
Yes.
coming. Okay, great.
Yeah. In fact, it's in like 3 slides, I think. Yeah. And I have examples on spend down because I know it can be confusing. So I'll try to demystify.
Wonderful.
spend
That's
down. Yeah.
interwoven into my SSDI Medicare Medicaid combo questions. So.
Yes. Yeah, absolutely. We'll get there.
One more quick question
Yes.
that popped up that is pretty relevant to what we were talking about earlier with Medicare. Will a client automatically be enrolled in Medicare after 24 months, or is it like a manual application process after 24 months?
Oh, that's
For
such a
that
good question.
SSDI client, I think.
Yes. And you know what? I used to do Social Security law, so I had this happen. But now that you asked the question, I can't remember if it's automatic or you know what? I think it is. I'm so sorry. I think it is automatic. But if somebody is aging into Medicare, that's when you have to apply. Like you're 65, that's when you have to affirmatively apply, or there could be penalties. I'm pretty sure it's automatic enrollment once you've met your waiting period, but I'm so sorry, I can't remember off the top of my head. If there's anyone on the call that knows the answer, please shout it out or put it in the chat.
Can they email Ask a Lawyer? Is this like something that they
Yes.
can
Email Ask a
somebody?
Lawyer. Yes, yeah, absolutely. Email Ask a Lawyer because that will give us a minute to remind ourselves of the rules and research that. Yeah, I definitely shoot that over to Ask a Lawyer.
Good questions, everybody.
Yeah, thank you everyone for engaging and asking all these questions. And it also helps me inform these trainings going forward. Like if there's something people really want to dig into, we can always focus on that next time. Okay, well, without further ado,
Yeah, go for
if that's
it.
okay, we'll get to the Citing Medically Needy program. All right, so I mentioned this term before. We just saw categorically needy, which is really based on income. You're at that 914, you're considered needy. There's also something called the medically needy program. This can be with or without spend down. But what this is it provides the Medicaid coverage, so that classic Medicaid, to people with income above the categorically needy standard and countable resources. I'm sorry, countable income. You know what? That should say countable income, not countable resources. I'm sorry about that. So it's people who have income above the categorically needy income limit, but below the medically needy resource standard. So that $2,000 that we've talked about, that is for all of these classic Medicaid programs. So I'm sorry, there's a typo there. So basically what medically needy program is, it's for somebody who has a disability or they're aged or blind, but their income is too high for the regular Medicaid eligibility, but they have such significant out-of-pocket medical expenses that once that gets subtracted from their income, it brings them below the categorically needy standard. So it's kind of a way to get coverage, get that categorically needy coverage if your income is too high. So this is for folks that, just have very significant out-of-pocket medical expenses. So maybe they have a lot of prescriptions. They have, I have clients where they're prescribed like compression socks or over-the-counter supplements, durable medical equipment, things that aren't covered by Medicaid. I had a client during the pandemic, at the height of the pandemic, their doctor prescribed them this like infrared cleaning box thing. I'm probably not describing it very well, but so once they've kind of gone out to the grocery store, they could put their immunocompromised, so they could put their groceries in this box. So it was going to be cleaned or sanitized through like this infrared razor type thing. So that was a significant out-of-pocket cost. So that her income or their income was normally over the income limit, but because they had to pay this really large thing out of pocket, it brought their income below the standard. And I have some more examples about like the actual math of it, but that's, you know, just kind of an example I had during the pandemic. You do still have to have limited assets and resources. So it's still this $2,000 income limit, resource limit. So the medically needy income and resource standard, it's not a limit in the same way that it was for categorically needy, because depending on how much you have to pay out of pocket for medical expenses, you may be eligible. So your income isn't as relevant for the medically needy as it is for categorically needy. But the monthly income standard, it is, for the most part, that $914. It goes up if you're in a family of 6 to $975. So this is what your income you have to get below this amount based on your out-of-pocket medical expenses. And then the resource limit does go up based on household size, but not significantly. It's still a pretty low resource limit. So how this program actually works. So if someone is going to be eligible for the medically needy program, they get Medicaid coverage once they've incurred a certain amount of medical expenses during a certain period. So this is called the Spenddown amount, or maybe we just call it Spenddown. And the excess income, so there's a couple of different parts of how you get to that Spenddown, what your Spenddown is going to be. There's something called excess income. And so this is the amount that your countable income exceeds the amount of your income set aside for non-medical expenses. Well, what is the amount of your income set aside for non-medical expenses? It's that $914. It's that income standard that we just talked about. The amount of your monthly excess income you have will be used to determine your Spenddown limit. So I have some examples to actually make it more clear, and I'll get to that just in the next slide. So I mentioned that there is this certification period. You have to have met your Spenddown during this specific time period. That is called a base period. And this is generally 3 or 6 months. The default is 3, but clients can ask or opt in to a 3-month. And I have some examples about why it's a kind of a strategic choice about why you might do 3 or 6. And so DSHS, it's a classic program, so that's who administers it, DSHS. They calculate the Spenddown by multiplying the number of months in your base period by your excess income. So let's just say I tried to use smaller numbers to make it clear. Let's say you have a client that has $40 in excess income. So they're kind of just over that categorically needy income standard, and they have a 3-month base period. So their Spenddown amount is going to be $120, which is $40 in excess income times 3 months of the base period. So once they have incurred $120 in medical expenses, their Medicaid coverage is going to begin. And then Medicaid will jump in and pay the rest of their coverage. So just a note, and Brianna, this might go to your question. A lot of the folks on the medically needy program, the reason why they're disabled, blind, or aged, but their income is over the categorically needy standard is because they are on SSDI, or Social Security Disability, and they're on Medicare. So Medicare is paying most of their care, 80%, but then they have this 20% that this is their responsibility. So once somebody meets their Spenddown, Medicaid is going to jump in and be able to pay the rest of whatever their responsibility is for the rest of that certification period. So I keep saying I have an example. Well, I actually got to the slide with the example. So I'll go through this with a fictional client, and then I have some tips about how to help your clients work with Spenddown, kind of some strategic things, and then I'll pause for questions. So let's say we have this hypothetical client named Sam, and they get $1,200 a month in Social Security Disability. So just off the bat, everybody who has a Spenddown, there's a $20 deduction for unearned income. If somebody is working, just a note, the deduction is actually a little bit higher, and then they don't count earned income dollar for dollar. There's some more math there, but this just example has unearned income because we're talking about someone with Social Security disability. But if you do have someone that's working, definitely shoot a question through Ask a Lawyer, or feel free to give me a call. We could come up with a different example. But so our client Sam gets a $20 deduction for unearned income. So his countable income is $1,180. So that's what DSHS is going to look at. So Sam gets to subtract $914 for non-medical expenses, which is that categorically needy standard. That number does change annually. I don't remember what the SSI standard was last year, but now it's 914. It goes up each year. It's, if the SSI amount goes up, it's that same dollar amount. So we get to subtract 914 from 1180, and we get $266. So this is Sam's excess income. And let's say Sam has a base period of 3 months. So the spend down amount is going to be $798. So as soon as Sam has incurred medical bills for $798, he can start getting Medicaid coverage, and Medicaid is going to pay the rest of his bills. Will pay the bills for the rest of the 3 months. So how does DSHS know that you've met your spend down limit? Well, the client does have to submit proof of their medical bills. DSHS isn't monitoring anybody's healthcare coverage. They're not monitoring how much somebody is paying. The client has to affirmatively submit proof of these bills. And so what they can do is, if they have a client portal, I think you may be able to submit there. I don't have a client portal, and I'm usually submitting on behalf of clients, so I haven't used that. Clients can bring in physical copies of the bill to the DSHS office. They can mail or fax in copies of the bills. And when somebody is submitting their bill for the spend down, my advice is write spend down unit, attention spend down, put the word spend down as many times, on your cover letter, on the letter as possible, because if somebody's on food assistance, they can also get some credit for their out-of-pocket medical expenses. So something that we have happen sometimes is a client will go in and bring proof of their medical expenses, and they mean it to apply for spend down, but it gets routed to the food assistance department anyways and gets applied to their food, but not medical. So my advice is just keep a copy. The client make a copy of the bills that they've submitted. If they can get it date stamped and take their copy home, fax confirmation, certified mail with tracking, anything you can do to prove that you've submitted that. And then you send in the copy, or, keep the original for yourself. I want to make sure I'm going through all my notes to make sure I'm not missing anything. Okay. So some things to remember about spend down. The eligibility period is 3 or 6 months. So if a recipient has a 3-month eligibility period, it's going to run from January to June, and then June to December. Medicaid will only pay the remaining balance of medical expenses through the end of the certification period. If someone has 6 months, it's June in this example. So in July, a new eligibility period and a new spend down period will begin anew, and the person's going to have to keep track of their medical bills, resubmit to show that they've met their spend down. I mentioned clients submit copies of the bills to DSHS, make sure it's very clear it's going to spend down. And then I wanted to give this example about, why you might choose 3 or 6 months. It may seem like I'm just reading from my notes, which I am, but I just want to make sure that the example is clear. So let's just go back to our client, Sam. And let's say Sam has a spend down amount of $300. I also made my example really easy math. So I don't have how much his income is. I just have his spend down amount is $300 for a 3-month base period, or $600 for a 6-month base period. So his excess income is $100 a month. So it's $300 for a 3-month period, $600 for a 6-month period. So usually it makes sense to do a shorter base period when you need to have an expensive surgery, like a dental surgery. So at one point, sorry, everybody. I wrote my notes to be clear, and now I'm tripping over my own words. So when you have kind of a one-time expense that's going to be expensive, like a dental surgery, that's when it might make sense to do a shorter base period. Because let's say this dental surgery costs like $2,500. With a 3-month base period, Sam is only going to have to pay $300 for the surgery. But if he had a 6-month base period, he'd have to pay $600 out of pocket. So the shorter base period makes sense for Sam because most of the surgery gets covered. He only has to pay $300 out of pocket. But, and let's say it's a surgery, it's $2,500, that's it, he's done. But if Sam is going to have ongoing, or maybe there's several surgeries and it's going to actually be more like over a 6-month period, that is when it might make more sense to have the 6-month base period, because although Sam is going to have to pay more out of pocket, he's going to get more coverage because now he's going to get covered for this entire 6 months instead of just it resetting after 3 months. So that's my spend down example, kind of trying to explain why it might be strategic to have 3 or 6 months. Hopefully that was somewhat clear. This would be a great ask a lawyer question. We kind of help clients work through this issue as well when they're dealing with the spend down. Yes, so I'm almost to the question slide if that wasn't clear. So just some more things to remember about spend down. I said incurred. Medical bills expenses have to be incurred. So they don't have been paid, just incurred. So the moment that the client gets a medical bill, they have a legal responsibility to pay that, so they've incurred it. So they can submit that to the spend down. So for our very first example with Sam, who has $120 spend down, if he had some kind of doctor's visit or emergency surgery and the bill was over $120, he could use that to meet his spend down. He's still going to be on the hook to pay it with the provider, but Medicaid is going to jump in and be able to start paying the rest, anything above that spend down amount. Medical expenses that a third party are liable for will not count as part of a spend down. So usually what this means is if someone gets into a car accident and the insurance company is going to be paying the medical expenses, that those expenses can't be counted towards a spend down. And then the actual expenses, there are some restrictions on what can actually count as for the spend down. The expense has to be prescribed by a licensed provider, and you have to have some kind of proof, like a receipt, an invoice, or the medical bill. So, it's things like durable medical equipment, prescriptions, surgeries, in-office procedures. I have clients that are prescribed supplements. So even though they're over the counter, they have a prescription, and we've been able to use that to count towards a spend down because we have a prescription and we have a proof that the client has paid for it. And then how to apply for medically needy. This is through DSHS. So folks can apply through washingtonconnections.org. They can call or they can go in person. And then once you're enrolled, you submit proof of expenses to the DSHS spend down unit. So again, just make sure it's very clear it's going to spend down. And then I recommend keeping a copy of your bills. Okay, I will pause there, open up the floor for questions. Happy to answer more questions.
I have a question. Oh, go ahead, Brianna.
My question, if it's too client specific, I can put it in the ask a lawyer, but I have a client who's on a spend down account, but can go to regular public health appointments and doesn't incur any bills from them for that. But then if we try to do anything behavioral health related, it all has to come out of pocket for the spend down. And I'm just trying to understand what's happening there.
Yeah, that is pretty common. And the spend down, it's kind of a good way and also a challenging way to get some kind of behavioral health care coverage covered, because once someone's met their spend down limit, they will be able to get the coverage, but then they're incurring the cost of, as I said, for spend down, you don't have to have paid the bill, you just have to have incurred the expense. But that means finding a provider that is willing to accept non-payment or like a very long-term payment plan for the client's out of pocket, their spend down to be able to get to the point where Medicaid will jump in. So, Medicaid, it can help people get coverage for mental health or behavioral care if they're able to meet the spend down, or if the provider that they're working with is, willing to let the client incur a certain amount of expenses to then be able to meet the spend down. So, depending on who the provider is, if it's, a private provider, that's probably going to be a harder sell. But if any folks on the call maybe work for more community behavioral health programs, or that's kind of the best answer I have for how to use the spend down to be able to get that sort of mental health and behavioral health coverage covered, if there's some kind of agreement or workaround that can be agreed with the provider, if the provider is willing to allow that so the client can meet their coverage. So like spend down is good in that at least there's that possibility, but it's also really tough because most people who have spend down, they're pretty high. They could be like hundreds of dollars, sometimes even thousands of dollars to meet the spend down. And, a lot of folks just aren't able to meet that because they can't incur that type of expense. I'm curious if there's anyone on the call maybe who is with a mental health or behavioral health provider who has any experience on their end, or anyone else who has thoughts that wants to chime in. So I know my answer isn't a great answer, but it's kind of the workaround that we've found.
Hi, Kayla here. I used to work for a couple different mental health programs, one of which was Medicaid funded. And so they're pretty strict. Like if they run the provider one, information, and if they see currently in spend down, they're usually going to say no. But if someone there can advocate saying like, okay, well, we'll pay out of pocket, and then they start getting the bills that they can then start sending into DSHS, that could work. Because once someone's a client, I don't know, it's sort of like, well, we can't just kick them out because they haven't paid, but they do need Medicaid. But still, it is an iffy, it's sort of case by case. There isn't really like a solid across the board answer. And that's only for the agency I worked for, like I don't know how they do it at other places. Unless there is a non-Medicaid based mental health program that still charges, which is unusual too, because they're usually grant funded. And then I don't know, it's like what you're saying is would work for some people in some situations, but not others, and it's just iffy. Yeah.
Thanks, Kayla. That's really helpful to have your perspective and experience. Yeah, thanks for sharing.
Awesome. I do have one question in the chat from Barb. Will every Medicaid client have a spend down expected?
No. So not everybody on Medicaid has a spend down. It's specifically for people who are either aged, blind, or disabled, and their income is over the categorically needy standard, which is that 914. So someone might be on Medicaid and have no spend down. They might be on medically needy and have no spend down because their income is just right at that cutoff point, so they don't have a spend down. There are folks that are going to be receiving Medicaid through the Medicare savings program, and that doesn't have a spend down. So not everybody on Medicaid is going to have a spend down.
And I don't see any other questions at the moment. But again, anybody is welcome to include them in the chat or unmute.
Awesome, thank you. So I'm going to switch gears a little bit and talk about Medicare, which is the federal health insurance program. And at Benefits Legal, we help clients with state benefits, and Medicare is a federal benefit, so we don't work on those types of cases. But I want to talk about a Medicaid program that helps people on Medicare. So I thought I would just provide some kind of basics about Medicare. And I do have a referral if people have questions about Medicare, some folks that are really knowledgeable to reach out to. So the basics about Medicare, it's a federal health insurance program. The people who can get Medicare, it's 65 years or older, or you've worked under the Social Security or retirement system. Certain younger people with certain younger people with disabilities or through a disabled parent. So that's people who are maybe on Social Security disability or adult disabled benefits. People with end-stage renal disease or types of kidney failure. There is a requirement, there's a citizenship and immigration status requirement for Medicare. And unlike Medicaid, Medicare does have premium costs. So there's 4 parts of Medicare coverage. You may have heard about Part A, Part B, Part D. Part A is hospital insurance. So this is if somebody has an in-hospital stay, they're in a skilled nursing facility. Medicare Part B is medical insurance. So that's things like doctor's visits, outpatient care, preventative services. Part C, this is called a Medicare Advantage plan. It's optional. And this means that your Medicare is being facilitated through a managed care plan. And then Part D is the prescription drug coverage. So this helps cost of prescription drugs, including things like vaccines, shots, that sort of thing. So I mentioned there are premium costs. Most people don't have a premium for Medicare Part A. There are folks that may have a premium. So if you have questions about that, I can probably answer those, but I always have to just refresh and double check since we don't work on Medicare cases too often. The Medicare Part B premium for this year, the amount is $169. It actually went down slightly from last year. Part C monthly premiums, it varies by plan. So we included a link where you can kind of compare costs for the Part C. And then Part D monthly premiums also vary by plan. And usually the higher income you are, you might have to pay more. And so we've included a link. And then of course, all the information about premium costs is available on Medicare.gov's website. So I wanted to share and put a plug for the statewide health insurance benefits advisors, SHIBA. So this is Washington State free, unbiased, and confidential help program for people with Medicare. And it's all ages, all backgrounds, there's no income requirements. And so there are SHIBA volunteers who are trained in all things Medicare, and they can help clients apply for Medicare. They can help clients figure out, should I have a Medicare Advantage plan? Which plan should I use? What am I actually eligible for? They can help plan. They can actually help you with the enrollment for Medicare. They can actually talk to Medicare on your behalf if you actually need to talk to Medicare. They can make other referrals. And then if you do have like concerns about Medicare fraud, they can also take and collect those reports. So there's a 1-800 number that you can reach to contact the SHIBA volunteers, or you go to the insurance commissioner's website. And then depending on which county you're in, that will depend on which volunteer you're going to be connected to. And in King County, Solid Ground, the agency I work for, but it's a different department, actually has the SHIBA, the volunteers. They manage those volunteers. So I've met with those volunteers. I've heard really good things about the work. So when clients ask me questions about Medicare, I always refer them to SHIBA. So another question that we often get is, well, can Apple Health or can anyone at the state help me pay for my Medicare premiums? We talked about Part A, Part B, there are $170. That's a lot of money out of someone's pocket every month. And the answer is yes, if you qualify for a Medicare savings program. So a Medicare savings program, this is a Medicaid program. Even though it has Medicare in the title, it's a little confusing, but it is actually a state-funded program. And it helps people who are already on Medicare pay for the premiums, but also deductible and cost sharing. So it's a really helpful program for folks that are low income. There are 4 programs within the Medicare savings program. I think of them as levels because they're based on your income limit. And I have some specifics on the next slide. I do want to note, so the Medicare Savings Program, it's not a medical insurance program. It doesn't provide any coverage or any extras. It just helps you pay for Medicare. So who is eligible for the Medicare Savings Program? The most basic requirement is you have to be on Medicare because it exists to help to pay for Medicare premiums and cost sharing. You do have to be a Washington State resident, but the MSP program is throughout the country. So if your client moves to another state, they will just have to enroll in that state's Medicare Savings Program. So you are either age 65 or older, or an individual with disabilities or permanent kidney failure, and you meet the standard income and resource limits. And the reason why I have that, the age and the disability part, is because that's usually how you get on Medicare. So you're on Medicare because you're 65 and older, or you're receiving Social Security disability benefits because you're based on a disability. There are income limits, but actually no resource limits. This is a typo. The resource limits are no more, but there are income limits. So the 4 type of Medicare Savings Program, I mentioned there's 4 levels. The most expansive, that covers the most things, is called the Qualified Medicare Beneficiary, or QMB. You may have heard that term. This pays Part A, Part B. It also pays deductibles and co-pays and co-insurances, except for prescriptions. So if you're not familiar with Medicare, usually Medicare pays 80% of whatever the cost is. And then the individual has to cover 20%. And so if you are just on Medicare, you're paying that 20% out of pocket. That's your co-insurance or your co-pay. If you're on QMB, Medicaid will actually pay that 20%. The next level is called the Specified Low Income Medicare Beneficiary, or FLMB. This just pays Part B premiums. The Qualified Individual, or QI1, also just pays Part B. And then the Qualified Disabled Working Individual, this just pays Part A premiums. This last one, the QDWI, this is for people. So this is a good issue spotting if you ever see this with a client. It's for somebody who was receiving Social Security disability benefits because they were no longer able to work, but they now have gone back to work, so much so that they've lost their disability benefits. Maybe they started earning enough income that they're no longer eligible for those benefits. Those folks are eligible for this last program and can get help paying for their Part A premiums. So these are the income limits for the MSP programs. You can see the QMB, that most robust level of the Medicare Savings Program. It's 100% of the federal poverty limit. So it's pretty low amounts for pretty low income folks. And then it goes up all the way to 200% for that qualified workers with disabilities. I already mentioned the QDWI, that's available for folks that were on disability benefits, but they lost it, but they're still on Medicare. And then the Qualified Individual, I think I'm gonna save, there's a kind of a specific issue to look out for that, but I have a slide, so I think I'm gonna save that, hold on to that for a minute. So as I mentioned, there are no resource limits for the Medicare Savings Program. They were eliminated in January 2023. So if you maybe come across a client that is on Medicare, their income fits, but for some reason they're not on the MSP program, it might be that they applied in the past, but they were over the resource limit. So I would really recommend they can reapply. And if the only reason why they weren't on the program was because of the resource, well, now that's gone and they could be eligible. Okay, so I wanted to highlight just a couple issues that we normally see with MSP clients, and then things that might be a good referral for our program. There is a federal law that actually forbids Medicare providers and suppliers from billing people in the QMB program for Medicare cost sharing. Even if they might have a bill or something that they are supposed to pay, these providers are prohibited from billing QMB folks. So we often use the term dual eligible. You may hear that. And we mean dual eligible because they're getting care from Medicare and Medicaid. There's no legal obligation for the most part to pay for those premiums or deductibles or co-insurance. However, we still see clients being wrongly billed. And this might be because, sometimes a client shows up to the doctor's appointment and they only give their Medicare card, but not their provider one card, or they give both cards, but the provider doesn't bill Medicaid or doesn't update their billing system, for whatever reason that they're wrongly billed. If you have a client that is being wrongly billed, definitely reach out to us. If they're in King County, we have this standard dispute format that we use to dispute these bills. And usually we just have to ask the provider to rebill Medicaid, and that fixes it, but we've had to escalate it in the past. So just if you see that issue, that might be a good referral for our program. One issue that's unique to the qualified individual level, unlike QMB and SLMB, someone cannot be enrolled in another government-funded Medicaid program while on QI. And what this normally looks like is someone is eligible, they're a qualified individual, so they're getting their premiums paid, but they also have a medically needy spend down. But as we talked about, the Medicaid part of spend down doesn't kick in until you've actually met your spend down. So in that interim, they're getting their premiums paid. But once their spend down is met and they get enrolled in Medicaid in the medically needy program, they get terminated from the QI program, the qualified individual program, and they will have to pay their premiums out of pocket for the duration of that 6 months or 3 months. And then Medicaid, medically needy resets, the spend down resets, and then they'll get re-enrolled in the QI program. So it's like a little bit of ping pong for folks, but I just wanted to flag that for individuals. If I should have mentioned this during the spend down part, but if you have a question or you don't think DSHS is calculating the spend down correctly, or you think a client's met their spend down or the income that they're using is wrong, definitely reach out and contact us. That's something that we often help clients with. So how to apply for the Medicare Savings Program? Folks can apply online, in person, or over the phone. If somebody is approved for the Medicare Savings Program, they will also be eligible for something called Extra Help, which is a program through Social Security, which helps pay for prescription premiums. So sometimes that's a way that people get enrolled in the Medicare Savings Program. But if you think your client should be part of MSP, it's actually a pretty easy application process because it's just based on income, so they don't have to prove anything about resources. I'll pause there for questions, and then I have just a few slides, the next couple slides about appeal rights and what to do if things go wrong, but I'll pause here for questions.
We have a good question from Brianna that I think you may have just referenced in regards to a person who is a qualified individual, if I'm remembering correctly. Brianna asked, would MSP be useful for people with a spend down, and how would they be eligible?
Yeah, it absolutely could be, depending on, let me actually, if it's okay, I'm going to go back to the income slide. So if somebody is on a spend down, depending on where their income sits, because the Medicare Savings Program, it's for people who are on Medicare. And so that means that they're on Medicare. Sorry, I'm trying to think of how to phrase this. If somebody's income is like they're eligible for one of the MSP, they can get help paying those premiums. And okay, wait, I'm sorry, Brianna. I'm going to re-erase. I'm going to answer this in a better question. We often see clients that they're technically on a spend down, but they don't have to worry about meeting the spend down because they are on QMB. So a client that is on QMB, they are going to get Medicaid through the Medicare Savings Program instead of having to meet the spend down in order to get the Medicare Savings Program. So I have clients who they're on Medicare, they're on QMB, they technically have a spend down, but it's like they don't necessarily have to meet their spend down every quarter or however long to get Medicare coverage because they're actually getting it through the MSP program. Now, in some situations, if somebody has a large procedure that's not going to be covered through the maybe Medicaid. Sometimes clients like supplements, or maybe it's like some kind of durable medical equipment. So it might still be worth it for them to try to meet their spend down so they can get that coverage. But there's a lot of folks that are, well, I don't know a lot, but there are people that are on QMB and technically have a spend down, but they don't have to worry so much about meeting it because they're getting their Medicaid coverage through QMB. I'm not sure if that answered the question, or, but let me know if it didn't, if there's a follow-up.
Yeah, can I just clarify with
Yes, yeah.
Okay. So this would mean that for my client that has the spend down, the MSP program would cover his expenses during that spend down time. And then once he meets his spend down, it would get bumped over to being covered by Medicaid. And so there could potentially be a workaround for him getting like mental health coverage that he doesn't have to pay out of pocket for.
Exactly. The one caveat I will say is it's just QMB that pays coinsurance and deductibles. So if his income is 15 or below, then yes. If his income is above that and he's eligible for like SLMB, that just covers premiums. So that's not going to cover the coinsurance or deductibles.
Great, good to know. Thank you.
Thank you for wading through some of the technicalities there. I'm sure you see a lot of like, just complicated cases that require a lot of interlocking systems, and I'm glad that we can see how those programs can work together.
Yeah, and one thing I will say, I haven't addressed this yet, but there's this, everything I'm talking about, the assumption is that the provider will accept Medicare or Medicaid. There are some, providers that they just don't take any Medicaid or Medicare clients. So all of this is to say, as long as the client is seeing a provider that will bill Medicare and Medicaid, then that's how they're going to be able to get all the coverage that we've been talking about. I think we're doing good on time, so I'll move on to the last section, and then we have plenty of time for questions, or maybe it could just be a conversation with all of us on the phone about what people are seeing and the challenges that they're seeing for their clients. Okay, so this is where me and my staff in my program fit in to all the wonderful work that you all are doing. We call them benefit pitfalls, things that can go wrong with folks who are receiving, Medicaid, the kind of programs that we've talked about. Benefits can be terminated or denied due to income or resource requirements, or maybe failure to report something. So if you have a client that is denied or terminated or assessed an overpayment, that is something that legal services can help with. Our program, and there's other legal aid agencies in the area as well. Also, services, procedures, or prescriptions can be denied. So some common examples is somebody requests a surgery, their doctor submits a prior authorization, and the healthcare authority denies or won't pay for it because it's not medically necessary. Or there's another option available. We see this happening sometimes with durable medical equipment. Children's orthodonture, that's kind of something we see that's pretty common. Prescriptions might be denied because the way the drug is being used or prescribed is different than what was approved by FDA. Maybe the doctor that prescribed the medication isn't considered a specialist, so the healthcare authority won't approve it. Maybe the healthcare authority will only cover generic and not brand, or wants the client to first try generic before trying the brand name. So the reason why I give these examples is, folks don't always think of these as legal issues, that there is where you can get the assistance of an attorney or a legal aid organization. They might just accept it. Well, if the HCA says it's denied, I guess it's denied. But we in our program, we help clients appeal these medical necessity denials, or help get prescriptions covered. There's a couple different avenues that we can pursue. There are things called exceptions to the rules you may have heard about, or we represent clients in administrative hearings. So this is more just like a flag for you folks out there. If you're seeing these issues with clients, feel free to reach out to us either through Ask a Lawyer or through our referral process. I just wanted folks to know that there are legal rights involved when someone's dealing with the healthcare authority or with DSHS related to their healthcare insurance. And so what you can do if something does go wrong, denial, termination, maybe a prescription's been denied. So you can, or the client has a right to appeal. And an appeal means they dispute or they disagree with the decision. And to do that, you request a hearing. So that's the mechanism to appeal. You request a fair hearing. You can request it by calling or writing DSHS or the healthcare authority, depending on who made the decision. Or you can contact the Office of Administrative Hearings directly and say that you want a hearing. You have the right to be represented by an attorney or another advocate. You aren't necessarily appointed an attorney, but if you are dealing with something I wanted to mention, if you're dealing with a client who maybe there's like a capacity or a comprehension issue and they're not able to navigate the hearings process themselves, they can ask for representational accommodation through the Office of Administrative Hearings, or they can contact our office, 211, CLEAR. These are a couple different avenues to try to get assistance, legal assistance. So in order to request a hearing, I just included the phone number for DSHS and the Healthcare Authority and also the Office of Hearing Administration. The letter that the client gets with the decision, the denial or the termination, it will say exactly how to request a hearing. So if follow-up fails and you don't remember, just you can take a look at that letter. There isn't supposed to be a magic word to request a hearing. If a client doesn't say, I want a hearing, if they just express disagreement or say they don't agree or they want a review, the department is supposed to process that as a hearing request. But there are deadlines to request a hearing. So if you're helping a client request a hearing, I would say just keep a record that you've helped them. So if down the road, the healthcare authority says, oh, it's past the deadline, you didn't request a hearing, you can help prove that they did request a timely hearing. So generally there's 90 days to request a hearing from an adverse action. Definitely read the letter that they get from the healthcare authority or DSH just in case it's a different deadline, but usually it's 90 days. If you want to get continued coverage, like if it's a termination of benefits, you can request for continued coverage and you keep getting your health benefits while you're waiting for your hearing. But you have to ask for that within 10 days of the date of the DSHS notice. So it's a little bit shorter of a deadline. So just want to keep that in mind. Oh, and then this is just a plug again for the Ask a Lawyer program. Question about eligibility, the questions, Brianna, you had, those are great questions to shoot over to Ask a Lawyer. And we just ask that you put Ask a Lawyer in the subject line if you remember, and that's how we'll be able to know where it came from. And then also, if you don't have a specific question, but you just have a client that you think needs legal assistance, you can make a referral. We have an intake phone number you or the client can call. We try to return messages within 2 business days. I need to change that from 24, it should be 48. And we have an email address, and then this is just my information if you want to send me an email. I'll put my phone number in the chat. It's missing from there. And that's it. That concludes the presentation for today. So I'll open it up for questions, comments, discussion. Thanks so much, everyone, I know it's a lot of information, so just appreciate your engagement today.
For anybody that has questions after the fact, maybe you run into a question from a client later today and you just hadn't yet before you had been to this training, you're welcome to, I think, Hannah, you're open to people emailing you directly potentially. Yes. If you have
I'm going to put all my stuff in. Yeah, I'm going to put my contact information in the chat. So you could email me directly. You could email the benefits legal. You could call.
Love it.
Send a letter.
Yes, and I will make sure to include the Ask a Lawyer and benefits legal assistance contact information in our follow-up email and blog. Yeah, great information and super timely, you know, as people are holding on to their insurance, you know, this is really important to discuss. I am, while we're still here, going to share that survey, that feedback survey link one more time. You know, Hannah partners with us a lot on these, and she consistently gets excellent feedback. If you have any questions about the structure or any recommendations on how to make these trainings even more useful, or maybe you don't find it useful and you have some good feedback for us in general, please let us know. Just gotta find that link again.
Can I put a plug? Also, if folks are seeing, you know, issues with the unwinding of the public health emergency, Sophie, you brought up a really good example. Yeah, if other folks have, and if you would be willing to shoot me an email and just kind of let us know what's going on, we want to make sure that we're trying to help, you know, advocate for improvements and yeah, keeping people from being terminated. So thanks so much.
Absolutely. Not to terminate Q&A, Q&A is still active, but to bounce off of Hannah's point a little bit about sharing information about issues that folks are running into with the unwinding, the coalition is holding a space on July 27th that is featuring some of our fantastic community partners from REACH to talk about tools and tips and tricks essentially to accessing state IDs and social security cards for folks, particularly folks who are coming from out of state. It can be very hard to access these documents and essential to access them so that people can get other resources. We're going to be talking about that. We're also going to, you know, continue having an open forum for people who just want to share feedback about things going on in the field, any challenges people are accessing or experiencing when interfacing with clients. I'm going to post the registration link in the chat. Unlike this session, it will not be a training. It's not going to be as structured and it's not going to be recorded. So it's going to be truly, you know, kept within the confines of the conversation. I'm going to stop the recording in case anybody wants to share and not be recorded.